Okay, great. Great. So welcome, everybody. It's my pleasure to welcome everyone to our first webinar, inaugural webinar of the series of webinars that we're sponsoring as part of the new Drexel Climate Change and Urban Health Research Center that was recently funded by NIH here based at the Urban Health Collaborative at the Drexel School of Public Health. As part of this center, we will be doing a number of capacity building activities and to support research development in the area of climate change and urban health at Drexel and at our partner institutions. And this webinar series is one of many, of several activities, and you can learn more about other things that we will be doing as part of the official launch event for the Climate Change and Urban Health CCUH Center on March 20th from 1 to 2 p.m., which will be here at Nesbitt Hall, and also there will be hybrid options for people to join in. You'll learn more about center and our partners, which include team members in Brazil and also in Central America. The series is also jointly sponsored by SALURBAL Climate, which is another big project on urban health and on climate change and urban health, focused on Latin American cities, supported by the Wellcome Trust. And before I introduce our first inaugural speaker, I just want to highlight on the slide, you see our upcoming webinars. We have a terrific set of speakers lined up, both in the US and in the Latin American region, who will be speaking on various topics related to our overall theme. And we will always be having Spanish and Portuguese interpretation as well. Sheila, did I forget anything?
No, if anyone wants to join and use interpretation, there's a button there on the bottom screen where you can log in, and we have two great interpreters joining us.
Great. So let me introduce today's speaker. We're very fortunate to have Mark Nieuwenhuijsen. Mark, did I say that right, or did I completely mess it up?
You did very well, thank you.
I practiced, Mark. I heard you say your name online, but I don't think I got it quite right. So I'm just gonna call it.
I'm not the best person. I mean, every Dutch person laughs at me when I pronounce my name. So
okay. Okay. So we're really delighted that Mark could join us as our first speaker, and he's really appropriate for this. We're very grateful. We know he had a long day, and this is the evening for him in Barcelona, so we're very grateful that he made the time. Mark is director of the Urban Planning, Environment, and Health Initiative and the Climate, Air Pollution, Nature, and Urban Health Research Program at ISGlobal in Barcelona, Spain. He is really an expert in a number of topics related to urban health. I first heard Mark speak many years ago now, I'm not going to say how many, talking about green space. At that point, Mark was the green space guy. I think you were like the green space person worldwide. And of course, he's done a lot more than green space. And he's very well published. He received a number of honors. He was president of the International Society for Environmental Epidemiology just a couple of years ago, and he leads several consortia funded by the European Commission, really focused on urban health in Europe. And so it's we look forward to your talk, Mark, and hope this will be the beginning of other conversations and collaborations between the Urban Health Collaborative and your group in Barcelona. So thank you so much for joining us today.
Thank you so much, Anna, and congratulations on the center. I mean, that's wonderful. I mean, and I'm looking forward to seeing more from your center, and also looking forward to collaboration. I think we need more. As you know, we have a big crisis, the climate crisis, so we need to address it, and also cities can play a very active role in this. I think probably the main actors for this to make the changes. I mean, for a number of reasons, and some of the reasons I'll point out here in my presentation. I hope it's not too long to my presentation. So I'll start going straight away. I'll go fairly fast through different things. If I'm going too fast, I mean, let me know what's happening. I would like to start off with with a paper that was published a few years ago on research priorities for cities and climate change by Bayer colleagues. I mean, I thought it was kind of an interesting paper pointing out, you know, that cities contribute a lot to CO2 emissions, traffic in particular plays a role, and I pointed out, you know, a number of issues as a result of climate change that is happening, and part of it was more research understanding what's going on, how cities play a role, and also bringing together different stakeholders, because I think we need to do it with a lot of different stakeholders, a lot of people involved, because it's such a massive challenge for all of us. That recently, there have been a couple of systematic reviews, I mean, that looked at the built environment of cities and in particular carbon dioxide emissions to see how, you know, current, the size, the shape, and activities within cities actually result in this carbon dioxide emissions, you know, one of the main greenhouse gases, and also some of the papers that were influential in shaping this debate. And I think one of the papers was by Severo et al. That looked at different indicators for the city, like density, diversity, design, how they actually could play a role in how cities function, but also, you know, how they may influence the climate debate. I mean, a lot of the papers that were in the review came back to this one, a fairly influential paper. And I think this is also some of the things that we need to look at. I mean, here the 3Ds, I mean, there are also 7Ds, 12Ds, as many as you can find actually. But here also you can see, I mean, the different pathways through which cities may lead, how it leads to CO2 emissions. I mean, through transport, I mean, how the built environment is set up, etc. What gives you a nice little insight. I mean, the main thing or the lesson from this is that cities play a very important role, and that depending on what they look like or what is happening, their CO2 emissions go up or down. I mean, ideally, I think what we would like to have is to reduce the CO2 emissions in our cities. And at the same time, also when you reduce the CO2 emissions, you reduce other emissions, you know, improve air quality, and you take other measures, other climate measures that actually can improve health as well. And I'll come back to that later. So here again, the second review that was there, also looking at different aspects, how land mix, density, city size, sprawl, etc., how they influence the emissions. Myself, over the last so many years, I've been working very simplified framework on how urban design influences health in cities. I mean, here the idea is it's very simplified. There's no feedback, no whatever. It just, you know, pointing out that urban design is related how people get around the cities, how they use the cities, how this leads to environmental exposures and lifestyle factors, and then to disease. I mean, in a way, what I'm trying to say here with this one is that, you know, if you design a city and invest a lot of infrastructure for cars, you're going to get a lot of people using the car, you get air pollution, you get noise, you get heat island effects, for example, because of the asphalt, particularly warmer climates. You get more stress, less social contact, less physical activity, what leads to disease and then premature mortality. On the other side, if you invest in, say, active transportation, if you put in cycling paths, you get more people to cycle, leading to less air pollution, less noise, less stress, more social contact, more physical activity, what of course reduces morbidity and premature mortality. So this is kind of point out, because you know how these kind of things come together, and with that, as what I showed you before, also it's related, you know, how we look at our cities to the CO2 emissions. In this way, the climate narrative comes together also with the health narratives. Also here, there are a number of places where you can introduce policies to reduce the health burden. And, you know, often, for example, I've been working a lot in air pollution and also green space, what Anna pointed out, where you can put in legislation, but probably you need to go further back to the urban design, change that, making sure that the urban design is optimal for reducing CO2 emissions, but also at the same time reducing air pollution and thereby also improving health. Ourselves, we've been working with a large data set of 1,000 cities, and we've published on this. And within the data, what we wanted to do in the cities, look at what is the burden of disease related to different urban and transport planning related indicators, including air pollution, noise, temperature, and green space, etc. And we do use this, burden of disease assessment or health impact assessment, but it's in principle a fairly simple method. We use the Utopia tool for this, which is the urban and transport planning health impact assessment tool that we developed. And the principle there is probably most of you know, but quickly to go through this, you look at what are current exposures and what you're interested in. Then you go to some counterfactual, either some recommended levels, like recommended levels by the WHO, World Health Organization, or some other, if you include an intervention to see where you can get the exposures down to, you calculate the exposure difference, get exposure response factors, functions from the literature, calculate the relative risk for the exposure difference, take the background mortality or morbidity rate, calculate the population activity fraction, and then the number of preventable cases or the burden of disease. And the method is very simple. The problem is often finding the data. So working with this data within the 1,000 cities that we have in Europe, just to give you some indication of what is the burden, we found that 60% of the population in our cities didn't have sufficient access to green space. And we use there the definition for the WHO that says that everyone should live within 300 meters of a green space of at least 1 hectare. We found that in our cities, 60% actually didn't. As a result, the lack of not meeting this guideline of the WHO, so the lack of green space within the cities, resulted, according to us, up to 43,000 preventable deaths each year. We also looked at noise. We found that 60 million people were exposed to noise levels that are harmful for health in these cities. And also particularly looked at air pollution. And here we ask ourselves, if we would meet the WHO guidelines for air pollution in the cities, how many deaths could we prevent? And we estimated that we could prevent 166,000 deaths each year. So the guidelines for WHO says what we have at the moment for PM2.5 is 5 microgram per meter cube, and for NO2, 10 microgram per meter cube. Of course, we also know that there are health effects below these levels still, but and if you go further down to almost zero, or the lowest measure that you can find in cities, the lowest level, you could prevent almost 200,000 deaths. So you can see that, currently there's still a very large health burden because of these different exposures in the different cities in Europe. If you look worldwide, Susan Annenberg and her team looked at this, and they estimated an excess of 1.8 million deaths in the many cities, almost 13,000 cities they actually looked at. We know also, that we have urban heat island effects in cities where the city center is warmer than surrounding areas, what also leads to considerable health burden. This is an example from Vietnam, I think it is, Minh City in Vietnam, where they see an increase in mortality because of the increase in urban heat island effects. We looked at this in Barcelona, more all the different exposures together that are related to urban and transport planning, including air pollution, noise, increased temperature, also lack of green space, and also the lack of physical activity, and estimated that there are almost 3,000 premature deaths each year in Barcelona as a result of what we call suboptimal urban and transport planning. because Barcelona is a very dense city with some of the highest traffic density in Europe. We have very high air pollution levels because of the small surface of Barcelona, what we have there. Also, we have this heat island effect. We've had the hot summers, you know, it's compact, a lot of asphalt, and also the concrete what we have, and of course also the lack of green space. I mean, there is not so much space. I mean, a lot, even though only 1 out of 5 trips is by car in Barcelona, the rest were public and active transportation. Cars take up so much space that in a way could be used in a much better way, but that's the situation what we have. So this is not untypical that. So, you know, also in Barcelona, what we can see there is some protest. I mean, there's too much pollution, in particular, if you go to the city center, a lot of cars, a lot of pollution. So people are fed up with it. So we need to come up with solutions. I mean, solutions that not only reduce the current air pollution levels and therefore also reduce the health burden, but also reduce some of the CO2 emissions related to that, because that's also our other problem what we have. So the kind of solutions what we should be looking at are land use changes, reduce our dependency on the car, trying to move away from car-centric urban planning, move towards more public and active transportation, and also trying to green our cities as different measures to address our current challenges. Of course, this is much easier said than done, but you know, as part of this, we've and other groups have been modeling, trying to see what are some of the policies that actually may improve this. One study that I always quite admire and like is a study by Mark Stevenson et al. Already published 8 years ago in the Lancet, where they looked at 6 different cities in different continents, and they looked to see, you know, if we make these cities a bit more compact, can this actually improve health? We know that we see a lot of sprawl happening around the world, so that's not very good for, you know, people need to travel much longer. I mean, it causes more CO2 emissions. People sit in the car more to travel. So they said, you know, if we make the cities that we look at more compact, and also so make the travel distances shorter, increase the density of the city, and also the diversity, so the land use mix, what would that mean for health? And so they did some modeling looking at this, particularly looking at factors like physical activity and other aspects. And they estimated that between 400 and 800 DALIs per year could be saved per 100,000 people for all these cities. I mean, what's remarkable is that, you know, there's health benefits in all 6 cities for this, suggesting, I mean, that we need to go to further densification and make cities more compacted. Now we also had the COVID-19 pandemic, and during the pandemic, what, you know, we valued our public space in different way. I think there was a bit of a rethink for this, and also what emerged were novel ways of using our urban space, or how to direct this. And one of the ones that was leading was was Paris, where they came up with the idea of the 15-minute city, or the city of proximity. The person behind this, Carlos Moreno, been around for a while, talked about this idea quite a bit, but then during the pandemic it was picked up and it got a lot of publicity, not only in Paris, in many different cities around the world. They considered this concept. I mean, the thing here, the 50-minute city, is the idea that, you know, all activities that people undertake and destinations should be within a 15-minute walk or cycling ride of their residence. In this way, also reducing the need for long travel with motorized transport. I mean, thereby reducing air pollution, also CO2 emissions, etc. So the idea is that you have, you know, close by your shops, cultural events, schools, work, etc. Now, of course, this is much easier in theory than in practice, because it's not so easy to move people around. I mean, the way they filled it in Paris is to put more destinations in the neighborhoods where you had before only residences, and because it's not so easy to move your work or your home assets. The other thing, kind of model that I quite like as a kind of urban model is the car-free neighborhood that's been implemented in Vauban and Freiburg. It's been around now for quite a while. This is a neighborhood with sustainable housing, which you can see at the bottom of the here on the right side. No cars allowed in the neighborhood, lots of green space, a wonderful place to live. I mean, the only thing is that, it's become so popular that that it's also quite expensive there to live, what is of course a drawback for this. Then the other two kind of models or other ways of land use are the low traffic neighborhoods and the super blocks in Barcelona, what I'll discuss a little bit now, a little bit more. So first of all, the super blocks in Barcelona. In Barcelona we have a grid system like you see in the US quite a bit. On the left side is the current situation for a large part of Barcelona, or was, I must say, where you have the grid system, traffic going up and down, left and right, and then a super block is being created by closing off 4 junctions in a apartment blocks together, and only allowing active transportation in there, walking and cycling, and also greening more. So as you can see, I mean, there's much more space for people and less space for cars and motorbikes. We have a lot of motorbikes in Barcelona. So the idea behind this, again, I mean, it's that people get a bit more physical activity. There will be less air pollution. There will be also less CO2 emissions because you expect people to change also transport mode. And the idea came from Salvador, who actually Salvador Rueda, who came up with the design and visits to have 502 super blocks in Barcelona. This is one example of one of the super blocks that was actually done as Sant Antoni. On top you see what it was before, so a normal street with lots of traffic. At the bottom, after they made the changes, I mean, it's more green, no cars anymore. Unfortunately, from the 502 super blocks and visits, only 3 have been implemented, and one of them is Sant Antoni. Anyway, we did a modeling exercise together with Salvador to see what's happening if you would implement all the 500 super blocks in Barcelona. We found that there would be a reduction in cars for about 20%, 25% reduction of NO2, reduction in noise, an increase in green space, and also a reduction in surface temperature. Altogether, we estimated that you could prevent almost 700 premature deaths each year if you would implement all the 500 super blocks. I mean, the biggest benefit comes from the reduction of NO2 exposure. Here in Barcelona, we have some of the highest levels of nitrogen dioxide exposure in a European city because of the traffic density, the high traffic density here in the city. And you can see this is followed by noise, how much you can prevent heat, and the lack of green, and also for physical activity. I think for physical activity, we underestimated the benefits because we had no idea, what would be the physical activity changes for people living there. We only looked at to see if people would change from using the car to active transportation. But what you can see, implementing these super blocks in principle would have a large health benefits. Unfortunately, only 3 have been implemented, and it doesn't look that they will implement more because we've changed mayor and they're not so keen on the super blocks. Then in London, as what I said, you had the low traffic neighborhoods. Here, the idea is to close off some streets for through traffic. And Young et al. Did an initial survey where they looked at 3 of these low traffic neighborhoods to see what is the traffic inside where it's been closed off after that they put barriers to let the traffic in, and also around it, because a lot of time people say if the traffic can't go through this low traffic neighborhood, you get more traffic around it. So they wanted to look at both. And actually what they looked at this here, and they saw some reduction within the in the areas where they were implemented, but not much around it. Also, for NO2, they found kind of the same effects. In particular, if you adjust for many of the other factors, you see a real difference in NO2 and also in traffic, where you see a reduction within the low traffic neighborhoods, but not much of a change around them. Oh, sorry, this slide, what you can see. There was a larger study what's done by Thomas and Aldrich, looking at all the neighborhood, and they found more or less the same for traffic changes. I mean, that you see a reduction in traffic, in cars within the low traffic neighborhoods, but not much of an increase around the low traffic neighborhoods. Now, another measure that we've seen in many cities, perhaps slightly easier to implement, but not so easy to enforce, is the reduction to a 30-kilometer speed limit within all the cities. I mean, this makes the city much more safer. We know that there are fewer traffic injuries, you know, when you reduce speed. And also, you know, to a large extent, it makes a much nicer environment. You don't have to speed in cars. The problem is, though, to enforce it. I mean, we see in many cities now that they put up signs for 30 kilometers per hour, but it's not being enforced. I mean, what is a kind of a limitation for this? But hopefully in the future, with better technology inside the car and also by measuring the speed of the car, this may actually improve that. Now, there are a number of other measures that are being implemented here in European cities. I mean, including low emission zones. So these are zones where you can only have cars, entering cars that are cleaner than most cars in a way, that have a certain certification, and also congestion charging for areas that allow only certain or that you have to pay to get in, like in London. And we see that there are also benefits for these, that would reduces to some extent the number of cars that are circulating, and also that we get cleaner cars, and also that the air pollution levels reduce. In this area, I say air pollution levels, but also CO2, because I mean, often they go together there as well. This is another systematic review that came out not too long ago, where in particular they promoted the idea of charging schemes to reduce the number of cars moving into the city center. They looked at 12 different measures and found this one of the most effective one. And then finally, there was this review that looked at different measures, so-called carrot and stick measures. And what they found is that, you know, whenever you introduce some of these schemes, the best is to put both carrot and stick measures in there. So you punish people on one side and give them carrots, give them benefits on other sides. What seems to be the most effective ones for these? Unfortunately, I must say, or not unfortunately always, but particularly in the European situation, perhaps it's slightly different in the US, I think, where there's a lot of car dependency. Here in Europe, I mean, what has been promoted is the electric car. And of course, it has some benefits. I mean, it reduces tailpipe emissions, what is in a way good, but you still have, you know, air pollution, for example, coming from tire wear and also brake wear. People still don't get physical activity when using the car, and also the car still takes up a lot of space. And in particular, you know, in European cities, what are fairly compact often, there's a real competition for space, and we could use this space much better than having some cars driving around. Also, we have to realize that many of the trips that we have are fairly short, the car trips. I mean, there are estimates that 50% of car trips are actually less than 5 kilometers, that actually could be easily replaced by cycling, for example. But, you know, to get people to cycle, you need to have safe cycling infrastructure, and I'll come back to this in a sec. We know there are many benefits of cycling. It reduces premature mortality. You know, if you cycle to work, you don't kind of need to go to the gym. You can use your commute as a kind of gym. There's less air pollution, there's less noise, zero CO2 emissions, except for the things you eat. it uses less public space, and cyclists are normally happier. Benefits of physical activity well outweigh any risk of inhaling more air pollution or because of accidents. That unfortunately still there are a few countries where a lot of people are cycling. I'm thinking there of Denmark, the Netherlands, the north of Belgium, what are reaching some decent levels, but unfortunately for many other places this is not true. This is the Netherlands. I mean, I love this picture. Go to Utrecht. They've changed a lot over the years. Where first this was also a major road for cars, and now it's a major road for cyclists, and you actually see not many cars around. I think now 80% of trips in Utrecht are taken by bicycle. But what is important for this is safe cycling infrastructure. I mean, I think it's a prerequisite to get people to cycle. This is a study that we conducted as part of the PASTA project in Europe, where we looked at 167 cities, covering 75 million people. We looked at the availability of safe cycling infrastructure as expressed by number of cycling kilometer lanes, what is the lanes in kilometers cycling infrastructure per 100,000 people, and the mode share of cycling. So what we can see is that up to 25% mode share of cycling, so 1 out of 4 trips taken by bicycle, there's almost a linear relationship between the availability of safe cycling infrastructure and the number of people cycling. And now here the question is, what comes first, the cyclist and then the cycling infrastructure, or first the cycling infrastructure and then the cyclist? And I believe more, and tend to be more, that you first need to have the cycling infrastructure to get people to cycle. Also, we estimated for how many deaths we could prevent if we brought up the modal share of cycling up to 25%, so 1 out of 4 trips by cycling in these cities, and we estimated that we could prevent more than 10,000 premature deaths. At the same, at the same time, there also, when you do this, get people to cycle, you reduce CO2 emissions as well, what is important. Here, the previous study was more kind of cross-sectional. This is a study done during COVID, where Krause and Koch looked at different cities, and they looked, some cities put up safe cycling infrastructure in the cities while others not. So they looked at the number of cities where this was happening. And what they saw was in the cities where there was safe cycling infrastructure, what you see on the right side of the picture, more people actually started cycling. So an average of 11.5 kilometers of this bike lanes increased cycling by about 11 to 48%. And I think this is nice because this is an intervention where you actually can see, if you intervene, what is going to happen. As what I said, I mean, if you look at this, if you get people to cycle, and this was Christian Brent and colleagues who were looking at this as well as part of the PASTA project, you could reduce your CO2 emissions quite considerably. I mean, that we know car use, I mean, still produce a lot of CO2 emissions, and the reductions because of cycling were quite significant in this way. But it's not only the transport, the mobility, but also the greening of cities what play a role in terms of, putting in more trees, etc. We know there are many benefits of green space. It reduces cardiovascular disease and cancer, reduces air pollution and noise, promotes physical activity, improves mental health, and increases life satisfaction. We know it improves memory and attention, both in the kids and the elderly, and also decreases urban heat island effects. Overall, we see also that it reduces premature mortality, and it helps a little bit towards CO2 sequestration as well. Now, it doesn't do so much as such, because normally the surfaces in cities are relatively small where green space is planted, but I mean, at least can help a little bit. But also to capture the imagination, I think you need to come up with some rules for green space. And this is what Cecil Konijnendijk did with his 330-300 rules. where he says that every citizen should be able to see 3 trees from the window, live in an area of 30% tree cover, and live within a green space of at least 1 hectare within 300 meters of the house. Now, this is just a rule of thumb. He came up with it. Many cities, in particular in Europe, are taking this over. I think also in some in North America. I don't know in South America how it's being perceived. But it sounds kind of nice. I think it sounds like appealing. Of course, I mean, the question is still, how does this go together with a compact city? We did a little study here in Barcelona using a cohort in Barcelona. No, survey, I must say. And we found that only 6% of people actually achieved this green space rule in Barcelona because it's such a compact city. But for the 6% of people, they were actually doing much better in terms of mental health indicators, like, you know, indications for poor mental health, medication use, and visits to professional for poor mental health. Varying from reduction from 23 to 76% in some of these indicators. Michel Kondo looked at Philadelphia, where you're based, to see, you know, if you would increase tree canopy cover from 20 to 30% in Philadelphia. What is the target for many cities, I believe, in the US? How many deaths could you prevent? And she estimated that you could prevent over 400 deaths per year, premature deaths, if you would increase the tree cover to 30%. In particular, there were more benefits for lower social economic status census tracts in the city because they had less green space to start with. What is an added benefits to reduce inequalities? We looked at the issue of the urban heat island effect. This is what I mentioned before, because of the concrete asphalt which you have in cities. You know, it absorbs a lot of heat during the day and then releases during the night, creating kind of a, you know, 3, 4, 5 degree excess temperature increase in temperature. As a result, leading, I mean, also to premature mortality, what I mentioned before. So what we found was that here in Europe, in around 100 cities we looked at, 40% of summer mortality is attributable to urban heat island effects. And that if we would increase tree cover in these cities to up to 30%, at the moment is around, the average around 15%. So if we double the tree cover, we could reduce the temperatures by about 1.3 degrees and prevent 1/3 of this premature deaths attributable to the urban heat island effects. I mean, you know, it's quite a considerable number if you know that 4% of summer mortality is attributable to the urban heat island effects. We're talking about thousands of cases each year. Finally, I would like to mention that, you know, I mentioned that we were trying to introduce there was this plan to introducing the 502 superblocks in Barcelona. That a bit fell through, but there was a replacement program, a slightly different program with more co-creation of citizens, etc., called the Ejes Verdes, the Green Access Program. This was a bit more limited in its ambition, and this involved greening some streets, pedestrianizing some streets in the city center, in the Exemplar district, the extension district of Barcelona. And here you can see the plan. This was the neighborhood, Exemplar neighborhood, where they had were hoping to pedestrianize 30 streets and also make them greener. So far, only 4 have been done. The main one is right in the middle, Concel de Seine. It's called the street that's been done, and then a few others have been done. But also, again, we did here you can see some of what it looked before and after. This is one of the streets, Roquefort, on the left, on the top. You can see what it was before, and then the others, I mean, their impression of what it looked afterwards, and it actually looks like that. We did a health impact assessment to see if you would introduce this plan of the green corridors, the green access in Barcelona, what would this mean for mental health? And we said when we looked at this, when you increase the green space, we estimated that you could prevent quite a few cases with perceived risk of poor mental health, use of sedatives or tranquilizers and antidepressants, and also visits to a health specialist. I mean, this varied about that you could prevent 8 to 14% of the cases for these different indicators. So, introducing this program, if you would do it fully within Barcelona, this could have large benefits. Unfortunately, as what I said, I mean, what happened was that we have done only 4 streets so far, so there's a long way to go, and probably we need to wait for a new city government, because the current city government that was changed last summer, they don't want to continue with this work. Then finally, also when you look at CO2 emissions, using this kind of measures, this greening measures, or what we call them nature-based solutions in cities in Europe, there was recently a very nice study looking at different cities, what could be the different measures that could be implemented in, looking at street trees and greening pavements, introducing agriculture in the city. They had a whole different range of measures that could be introduced, and they looked at some of the main cities in Europe to see how these nature-based solutions and what type actually could help reducing the CO2 emissions. I mean, here you can see the list. I won't go into detail into it. But these measures also have some impact for CO2 emissions and CO2 sequestration. So this is also quite important. Finally, I mean, I've been talking that we should densify, make the cities more compact. Unfortunately, what we see that there is still sprawl going on in many places. And surprisingly enough, like Europe has been kind of the leader in sprawl over the last 20 years. I think it's reduced now a little bit because of different policies taking part or being introduced. But it was, for me, kind of a surprise that this was still happening. We need more housing, but to get more housing, we need to densify and not further sprawl for that. To work all together is, I think, what we should be doing. I mean, we need to look at systemic approaches. We need to look at multi-sectorial approaches, bring together not only the environmental sector or the climate sector and the health sector, but also go back to urban planning, back to traffic engineering, or also for education. I mean, it's surprising how many kids are still being taken to school by car. I mean, while they should be using other ways when it's possible. So we need to work with many different sectors to come up with our solutions for our environmental challenges, for the climate challenges, and also for our health challenges. I believe to some extent that we should, put urban planning at the center for environment and health. I mean, to reduce our health burden. What I think is often missing in this way is the kind of a shared vision of a better city. There's no clear rationale why there's being done certain ways to reduce the health burden or pathways to get there. And often when there are restrictions being proposed, like the low traffic neighborhood or the super blocks, citizens think that costs are being imposed by them just to pester them, rather than for something for the good, to address the climate crisis or to improve health. And we need to come up with a better vision what a sustainable, livable and healthy city looks like, and also bring the citizens on board and show them the benefits of better urban planning. Can it be done? I think so. A few examples here. Seoul, on the left side, they had a motorway. They took the motorway away and they made a nice river area or a canal area with green space, much better place. This is a little commentary I wrote. I don't know why it's here, but also that city should be at the heart of climate action and public health. Here is another example in Düsseldorf. They love their cars in Germany, but again, they took the road space away near a nice water area and introduced more green and pedestrian routes. People sometimes think that people always been cycling in the Netherlands, but if you go back to the 70s, on the left side of this slide, you can see that there were a lot of cars going around Amsterdam. It's hard to believe, but nowadays, most people cycle there. This is a hospital in Liverpool, Children's Hospital. On the left side, the old hospital with a park next to it. They needed to get a new hospital. They asked the children, what would you like? And they said, we would like to have more green space. And so what they did was build a new hospital where the park was before and put green on top, and the old hospital became more park space. So that's the way how you create more urban green. This is what I showed you before. I mean, it's Vauban. It's a car-free neighborhood in Freiburg, worth visiting. Wonderful place. A bit expensive nowadays, but one of the drawbacks. And this is one of my favorite streets in Barcelona, Rambla de Poblenou, pedestrian streets. With cycling lanes on the side, lots of trees to protect you against the heat in the summer. People live there, people work there. It's very lively neighborhood where you can get whatever you want, and what is, I think, very important. That if you want to read a little bit more, there are a few publications that I wrote over the last few years. Talking a bit more about the new urban models, these innovative urban models that you could use to improve health and livability, and also reduce CO2 emissions, and also certain pathways how to get there. Finally, we're doing a large project called the Urban Burden of Disease for policy making. We're using the database for 1,000 cities in Europe, and we want to look at trends over time, over the coming years, in terms of air pollution, noise, and temperature, green space, etc., and estimate the burden of disease and mortality related to that, and also pick some cities where we look at specific interventions and do some modeling. What would be good scenarios to make the cities much healthier and also reduce CO2 emissions. We do quite a bit of stakeholder involvement, engagement, to make sure that we get some support. I mean, at the bottom you can see the website for the project, and if you're more interested, you can write to me and work on this. Finally, I mean, I often talk about these things, but there's a whole team behind it. Here you see some of the key players that have been producing some of the work, and we're always celebrating when we produce or when we publish a new paper. So that's why they're all looking happy, because the work is done and the paper was published. Thank you so much for your attention, and I'm happy to take any questions if you have some.
Thank you, Mark. That was fantastic. A great start to our series. And I think we have time for some questions from the room here or online. We're monitoring the Zoom. I know there were already some exchanges in the chat, but
yeah, I haven't been following the chat, so I don't know.
That's okay. No, you can't do that while you're talking. Well, I have one question to start us off. So, I mean, you've done an incredible job producing all these estimates of the potential impact of various city policies. And have you found, how much receptivity from policymakers have you had? I mean, have you found that because there's often talk that this is needed, that we need to produce these kind of estimates. Have you found that that's the case, that they have used your numbers to support policy, or what kind of reception have you gotten?
Yeah, let me do it at slightly quite two different levels. First of all, it's kind of the Barcelona level. We've been working quite a lot with Barcelona City Council, and as what I mentioned, we had an election in May. Before that, we had Ada Colau as mayor and Janet Sanz for urbanism. And I must say that we're super happy with our work. I mean, they always said, keep publishing this. It's the health argument. You can't argue with that. keep producing this, though we can introduce policies to reduce these exposures like air pollution. So that's one of the reasons behind the superblock idea or the Echesbergers. So they were quite receptive to this. And then we got a election, and then we changed the mayor in May. It's a different mayor, Colboni. Unfortunately, this government is not receptive to this at all. They don't believe our estimates. They say, doesn't help us at all, and they have different priorities. So I think, on this kind of level, it depends a little bit, who is in power, what's happening, what is their agenda. At the moment, the current mayor says, oh, forget about it. I don't want to hear about superblocks. I don't want to hear about Echesbergers. We've got other things to do. Then on a European level, over the last 2 years, we've been working on updating the Ambient Air Quality Directive to try to reduce the limits, the safe limits, or the thresholds for air pollution in Europe. I mean, they were very high. We had the current levels for NO2 of 40 micrograms per meter cube, and for PM2.5 25. And now, there's been this process, and now they're going to be brought down to 10 for PM2.5 and 20 for NO2. As part of this process, also they looked at our data, because cities are hotspots, and really recognized that the health burden is way too high. And so this data, these estimates really have helped to drive the health argument in the debate for the ambient air quality. Before, the ambient air quality directive was more an environmental debate, and people didn't make the link to health. But then now, because of the data, the numbers produced, it became really a health argument. And then it's very hard to argue against it, in particular on a European level. So in that way, this estimates helped a lot, and also to understand, what are the sources of air pollution, what needs to be addressed, what kind of sectors need to be addressed to reduce the air pollution levels. I mean, it's not always so easy. I mean, if you look at NO2, to a large extent, it's motorized traffic that's contributing. But if you go to PM2.5, you got many different sources. So you need to have many different actors also to reduce these levels. So it depends a little bit. I mean, for some of the, it's what I said, it's been useful for some policymakers. Others don't want to listen.
Thank you. That's helpful. I think there was a question in the chat. Can you pull it up? Or ask the person to ask it.
Sure. So the question was, curious to hear your opinions on urban planning options facing kind of established, stable, or shrinking cities in developed nations versus rapidly expanding or growing cities in less developed places.
Yeah, it's an interesting one. That what we see is that also in Europe, we see, I think 40% of cities are actually shrinking. I mean, people are moving to other cities that are more successful. I mean, and as you know, often there's competition, between cities to attract people to the cities, to attract workers, etc. So what we're seeing is in Europe, but also other places, that some cities the population is really going down, and you get into this kind of circle. I mean, where economically it goes down and you get fewer people. There are some advantages that you can create more spaces to introduce green. I mean, we've seen that in European cities where people were moving away, they just tear down houses and put more green space in there. What is nice for the people behind, but if you don't have jobs, it's difficult. On the other side, we see some cities, in particular also the global south, that are rapidly getting bigger, and where there's a lot of pressure. I mean, there's a lot of density, what brings with them other problems. I mean, that every little space is being used. I mean, and so there is not so much space for say green space. I mean, that often what you see, there is no urban planning or no controlled urban planning. Things just grow, or there is no good mobility policies, that people rely on the car and they get actually stuck in the car during their commute for a long time because there are no alternatives. no public transport, etc. But you know, you have to look at it in the context of different cities. I mean, every city has its own problems, has its own context, I think. So you can't so quickly generalize, I believe. And so you need to also, when you look at solutions, look specifically which countries you're talking about, you know, national level policies, but also on a city level, what is happening within the city for this.
Thank you. Any questions here in the audience here? Comments? Is there another question online?
Do have one more if there's anyone else here.
Okay, go ahead.
Noticed during your explanation about that HIA that you said something along the lines of the method is simple, obtaining data can be challenging. And could you expand a little bit more on that?
Yeah, so one of the things is, of course, I mean, it's a kind of simple concept to do, but then if you need to get the input data, I mean, you know, think about you do the HEA, you want to do an HEA on some kind of intervention. So you need to have some data on exposure before, what is the current level? I mean, it's often easy to get, but then also what is going to be afterwards, what's going to happen, what kind of assumptions you're going to make, what are the exposures after you introduce something, or when you do the burden of disease assessment. And so this kind of data is not always so easy to get. I mean, also I gave the example of the 502 super blocks where we did some modeling. I mean, and I'm sure that we made some mistakes. I mean, you know, these are rough estimates of doing the models what you put in. Or what coming out of the model, you put in some things and then something comes out for what going to be the counterfactual exposures or the exposures after the intervention. Ideally, what you would do if you have, you know, other interventions where you do it before and after, like what I showed a bit for the low traffic neighborhoods, but you know, doing the evaluation of these interventions to get actually data that you could put in your modeling exercise for your health impact assessment is super difficult. I mean, I think I see more interventions failing, or the evaluation of these interventions, because often, you know, they are too small, or there other things are happening at the same time, or you know, it's so difficult to do actually getting this kind of data. Still, it's the best what we have. You know, they always say from every model is wrong, but some models are more useful, and this is for modeling the exposures, but also modeling the health effects for this. Some other things, I mean, if you look, for example, if you want to, you know, if you do things for one city, often you can get the data. It takes quite a bit of time. But what we're doing, for example, for the 1,000 cities, you know, what we find is that quite a few cities have mortality estimates, annual mortality estimates, but others don't. So we need to do some modeling for this for the cities that don't. At the same time, for 1,000 cities, you can't get any morbidity estimates, background morbidity estimates. Ideally, we would like to do this work also for various diseases, but we don't have the data to do this available. The other things is what we would like to look at is you know, differences by social economic status of the neighborhoods or so. If you want to do that for 1,000 cities, there are no databases available yet in Europe, at least, where you can do this on a neighborhood level to see what's happening. And so these are some of the limitations of these approaches, because the data is not available, or the data are not good enough to do this. Of course, we keep trying, we keep doing our best and looking at improvements over time, all the time.
Thank you. I think we have time for one more question. Go ahead.
Yes, so question on the equity aspects of this. You mentioned that that neighborhood in Freiburg, however you pronounce that, sorry, was now very expensive to live in. And so, of course, the benefits of the great things of that neighborhood will only accrue for people living there. I'm wondering if you have any thoughts on that.
Yeah, so, you know, one of the things what we often see, of course, if you improve neighborhoods or make them attractive, I mean, people are prepared to pay a bit more for them, and you can get some gentrification. So Freiburg in Vauban, or the Vauban area, was a new neighborhood. I think at that time it wasn't so attractive because people couldn't have a car. And so at the beginning it wasn't as attractive because, hey, what I'm going to do with my car? Everyone has a car. What I'm going to do with it? I mean, you can't use it. So then it wasn't, but as soon as people lived in there and found out that this was a very attractive environment because you were not bothered by cars, you could walk around, your kids could just go to the community center, walk by themselves rather than they needed to have someone there, you had more green space. Then people realized from, oh, I want to live there as well. And then it became much more expensive. And I think, you know, what I've heard from people, it's not affordable anymore for normal people nowadays. So for my take on this is, you know, it's attractive. People need to realize that there are benefits of this, and we should have more of this neighborhood to, you know, given to the demand. I mean, that's actually there. Often what I see also here in Barcelona, for example, initially people are against changes. You know, they say from, no, we don't want to do this. We don't want to lose our car. We don't, you know, this. And what people find a lot of things, you know, to be against something. I mean, people don't want to change. But as soon as the changes are being made, I mean, what I see also with the super blocks here in Barcelona, the Consell de Seine, people say, oh, this is wonderful. Why don't we have more of them? But of course, then becomes more attractive. People want to move in, and you need to make sure that people don't have to move out because they can't afford it anymore. My say on this again, I mean, go for the whole of Barcelona. You know, make the whole of Barcelona nice, but it's of course not that simple. I mean, you find people against it, and it's also costly to make these changes.
Well, thank you so much, Mark. This has been terrific. Thank you so much for sharing all this great work with us, and we hope to continue to be in touch with you and your group. Thank you very much, and thanks everybody for joining today. And we'll see you at our next webinar, which is
April, oh geez, 10th
Sorry.
or 11th.
Okay, April 11th.
Yeah.
So thank you. Thanks again.
Thank you so much, and I'll send you the presentation. I mean, then you can distribute it if you want.
Okay, wonderful. Yeah, that would be terrific. Thank you so much.
Excellent. All the best. Thank you. Good luck with your series.
Thank you.
Thank you.
Bye.